Hello, Kean University. I'm Emily Powell, and I'm applying for the Speech and Language Pathology Master's Program. Early on in my college career, I learned about patient wellness, but it wasn't until I took a class called Medical Humanities that I discovered my passion for patient stories. The class was about different kinds of therapies and the emotional toll that the healthcare system and illness in general can have on a person. It was my favorite class because it revolved around the human connection between patient and provider, instead of textbook definitions that classes revolved around prior. I developed an interest in narrative medicine and went on to speak about it at a symposium at my current college, Stockton University. Around the same time as this class, I taught at a local high school marching band program as a color guard instructor. I participated in the same program for 4 years as a high school student, and I was excited to return to the sport I love as a part of the staff. This job taught me a lot about myself. It taught me that I have a lot of patience, and that although it can be frustrating at times, I have a love for teaching. My favorite part about teaching is connecting with the students as individuals and creating a fun environment to learn in. A mix of my medical humanities class and my job led me to the conclusion that clinicians should consider themselves to be teachers. Sometimes they can get caught up in the technical side of healthcare and experience a disconnect from their patients. An example of this was when I observed an outpatient facility about a year ago. After an hour-long appointment with a hyper child who had difficulty following instructions, the SLP turned to me in her office and said, "Now that's an effective birth control." I was shocked by how disconnected she seems, and I knew that if I were to continue in this field, I would have to place a priority on establishing patient relationships. As of right now, my current goal is to be as culturally competent as possible and to continue seeing patients as humans instead of their diagnosis. My belief is that it is our job as SLPs to help patients regain their ability to share their stories, and I hope that Kean will be part of my story. Thank you for listening, and I look forward to hearing from you.